My name's Tobi, and I'm a community paediatric dietitian at Birmingham Community Healthcare NHS Foundation Trust. This is what a day in my life looks like. I work with children with a range of medical conditions and dietary needs, such as selective eating, food allergies, faltering growth, or needing nutritional support. Working in the community means I see patients in different places other than hospitals, like special schools, community clinics, and even inpatient homes. Today, I'm seeing children at Allen's Croft Children's Centre in Birmingham. After signing in upon arrival, I head to my clinic room for the day and get things set up for patients. I start seeing patients from around 9 AM, so I get the patient information system set up on my laptop and check my notes for the first patient. On the system, we can see things like their date of birth, which I confirm before the start of the consultation, along with their medical history, measurements, and the reason they have been referred to a dietitian. My first two patients today are infants between 1 and 2 years old who were referred for advice and support managing a cow's milk protein allergy. This is one of the common reasons I see patients. We also offer online support sessions for this. Most children tend to grow out of this by the time they're 5. We may give reintroduction advice such as a milk ladder, which is a step-by-step reintroduction of dairy, building up to cow's milk over some time. I see children of all ages, ranging from birth to 19 years old. Because of this, a parent or guardian usually accompanies them during their appointment. I'll speak to them about what happens during a consultation before we look at their past record or referral information. I may also take weight or height measurements to assess the child's growth. After this, I ask them how they've been and why they are here. Depending on the information I gather, we set a plan which could involve being discharged or booking a follow-up appointment. If necessary, we will provide them with supporting information leaflets or let them know where they can get more info. A consultation usually lasts around 30 minutes, so we can see quite a few patients each day. My next patient is a bit older. He was referred for advice regarding selective eating and to try and improve the variety of his diet. This is another of the common reasons I see patients. Selective eating happens when patients, especially those with sensory issues, limit their food intake for a number of reasons. This might be how they process the smell, texture, or taste of particular foods, leading them to often eat just 10 or less accepted foods. There are a number of ways we can support patients with this. Depending on the severity, they could be referred onward for more specialist advice, or we can provide them with strategies to improve the variety of their diet at home, such as messy play, food chaining, and the use of encouragement and rewards. After seeing my patients for the day, it's time for a virtual team meeting. Because our team works in the community rather than being based at a hospital, we're often all working in different locations, so these meetings often take place online. In these meetings, we discuss our individual plans for the week and ensure there is adequate cover for all of our clinics. We also discuss more complex issues we found with our patients to get advice from colleagues within the team. After a break for lunch, I catch up with colleagues from other professions. As dietitians, we work as part of a multidisciplinary team. This means we work with other healthcare professionals in other services, such as speech and language therapists, physiotherapists, nurses, pharmacists, and more. This means we can all input into patient care and treatment, ensuring the best possible support and care. Towards the end of the day, it's time to catch up on some admin. I write up my patient notes onto the system, prepare any letters that need to be sent out, feeding back to the referrer, or requesting prescriptions from GPs, and respond to any emails I've received throughout the day. I also triage patient referrals by checking them against our acceptance criteria and noting whether they meet this or not. This includes things like food allergy, faltering growth, or if the child requires nutritional support. Before you know it, it's the end of the day. I've caught up with all my admin and emails, and so it's time to log off the system and head home. I like my job as I've always wanted to work in paediatrics because my mum's a paediatrician. While we are supporting children with serious medical conditions, It is incredibly rewarding to work with them and their parents, seeing them enjoying as many aspects of a happy childhood as possible.